Good afternoon and welcome to this COVID-19 Town Hall event hosted by the County of Marin and Marin Health and Human Services. I'm Lainey Hendricks, Public Information Officer, and will serve as your moderator this afternoon. I want to let all of you know that Spanish interpretation is available for this event. And at this time, my colleague Kellen will provide instructions on how to access that interpretation through Zoom. Kellen?
Hola, buenas tardes para todos aquellos que nos están acompañando esta tarde. Si ustedes quieren participar o escuchar esta conversación en español, lo que necesitan hacer, si están utilizando su computadora, oprime el botón que dice interpretación y haga clic en el idioma que desea escuchar, por ejemplo, Spanish para español. Si desea solamente escuchar esta conversación en español con la interpretación, a favor de apagar o silenciar el audio original. Si ustedes nos están participando por su celular y desea escuchar esta conversación en español, a favor de entrar en Zoom y busca los controles de la reunión y toque el más, o sea, son tres puntitos. Ahí habrá de tocar Language Interpretation, o sea, interpretación de idioma, y tocar el idioma que desea escuchar, que es Spanish. Muchas gracias.
Awesome. Thank you, Kellen. I also want to let you know that we are offering live captioning for this event. If you are joining us on Zoom.
Buenas tardes para todos.
I think we're good, Kellen. Thanks for that. If you're joining us on Zoom, you can access the closed caption feature at the bottom of your Zoom browser. Simply click on that CC button, and that will open up the captioning option for you. And if you're watching on Facebook, there's nothing you need to do. Those captions will automatically appear. Well, tonight our theme is COVID-19. What's next for Marin? And with the blueprint for the safer economy going away next Tuesday, June 15th, our local community and our statewide economy are going to get a lot closer to what normal felt like before COVID-19 was even a part of our vocabulary. Now, to walk us through a little bit of what's next for Marin County is a dynamic lineup of health experts and community leaders. Our panel this evening includes Marin County Public Health Officer, Dr. Matt Willis, Deputy Public Health Officer, Dr. Lisa Santora, who will be joining us a bit later, District 4 County Supervisor and Board President, Dennis Rodoni, Mayor of San Anselmo, Brian Colbert, and Chief of Pulmonary Medicine and Critical Care for Kaiser Permanente San Rafael, Dr. Laura Eberhard. Now, over the course of our event, each panelist will share their summary of next steps for specific industries and what our community should be prepared for in the weeks ahead. Now, to kick things off, please welcome District 4 County Supervisor and Board President, Dennis Rodoni. Supervisor Rodoni.
Thank you, Lainey, and thank you all for attending this town hall tonight. I'm Dennis Rodoni, President of the Marin County Board of Supervisors. In March of 2020, we saw our first COVID case. Our first death came on March 27th when we lost Lucio Gonzalez to COVID. Today, almost 15 months later, and you can go to the next slide, please, we've experienced 11,918 cases of COVID, 184 deaths with 38 active cases. This slide shows the number of cases per 100,000 for different members of our community. And this represents that we have one person hospitalized currently. Throughout the year, plus with a team effort, the Board of Supervisors, the CAO's office, emergency personnel, county employees, HHF staff, and public health led by Dr. Willis, we are at a turning point. And by following the public health directives, we are ready to return what would be a new normal. That's why our public health officer feels prepared to move forward with the reopening. Next slide, please. With excellent vaccination rates, In fact, we have 198,100 people in Marin who have received at least one vaccination. And as this slide, 89% with one dose and 79% with two doses, and we have 65% of the population fully protected. We can now turn to the recovery. Again, pointing to our successes, our Latinx community and Asian American communities are the highest vaccinated communities in Marin. Next slide, please. Oh, I think you missed one. Is there one missing, or did we go to the next one, please, and see? So Marin Health and Human Services mission has helped drive the county's response in protecting the health of all Marin. Our decisions and protective guidelines follow the science, the data, and the evidence while making sure we approached every issue with an equity lens and building partnerships with our community CBOs, our business community, and our community members, and always with the utmost transparency. Proof of this success is our low case rates in our Latinx community and our African American community, both.
Supervisor Rodoni, I think you may have gone on mute by accident. Can you check your audio?
I'm sorry about that.
I think we only lost those last two sentences. Don't worry.
So in Marin, we're grateful to our partners and collaborative response that we shared with them. Each one of you needs to be congratulated for enabling Marin to have low case rates, low hospitalizations, and fewer deaths. And now getting your vaccines has turned the corner, making Marin a leader in the state and the nation. I believe Marin has been able to use the response to the pandemic as an evaluation tool for how we were delivering services and how we need to change the way we are delivering services. From the remote use of Zoom and other technology to communicate, to understanding how to deliver culturally sensitive services to our Latinx and Asian American and communities of color, we have learned a lot. There's a lot to recover from: loss of business activity, loss of jobs, loss of income, loss of housing, loss of school time, and mental health and other health issues either ignored or exacerbated by the pandemic. These will be our challenges for the next few months and even years. Our lessons learned will provide the best roadmap going forward. I am pleased that Marin is in an excellent position to face these challenges. Thank you so much.
And thank you, Supervisor Rodoni, for really that helpful perspective and kicking off our talk today. So now let's move to the person who has been the face, the calm voice, the steady leader for Marin throughout this pandemic, our health officer, Dr. Matt Willis. I could read your entire bio, but you know what? We've all come to know you pretty well over the last 15 months. So with that, Dr. Willis, I will hand it over to you to take over.
Thank you, Lady. And thank you, Supervisor Rodoni. Thank you and other board members for your continued support throughout this pandemic. You know, as I look across the state of the nation and see how public health leaders have been treated in other areas, I feel especially grateful for the support and the trust that was put in for myself and Dr. Santora and other leaders in healthcare throughout this pandemic. So I'd like to talk a little bit about where we've been. I'll offer a retrospective view, and that will help set the stage for why I feel confident that we're able to move forward as we reopen on June 15th. Next slide, please. So this is our current status. This is our website. One of the principles we've been following all along is to try and be as transparent as we can be, sharing data on our website. This is each day, this is updated about 4 o'clock. What's remarkable about this today is that it says that there are 38 cases actively in Marin County. That is the lowest number we've seen since, perhaps ever, since we first started tracking it. That means that there's only 38 active cases in the county right now over the past 2 weeks. Another sign of the progress we've been making, and largely due to the protection of vaccinations. Next slide, please. And this is our epidemic curve. Each day is represented by a bar and shows from the very beginning, as Supervisor Rodoni indicated, our first case in early March. was also our first death. And we're now seeing rates that are similar to, we haven't seen rate this low since the beginning. Next slide, please. So taking that historical view, I'm remembering, the very earliest days of our awareness of this pandemic, when reports were coming out of China of this new virus that wasn't even called COVID-19 at that time. And other health officers, including myself, gathered together in the Bay Area because we were seeing exponential growth in the numbers of cases, and we felt like it was time to take action, and came together to institute the first shelter-in-place policy in the nation. And reading this press release reminded me that it was intended to be 3 weeks. So we were looking at 3 weeks, and the words were, temporarily changing our routine will be necessary to stopping this. Here we are now, well over a year later, and now just beginning to coming out of that. So that shelter in place has been in place, and it's a historical moment that next week on June 15th, we will finally graduate beyond that. It started on March 16th. Next slide, please. This is looking back at our case rates in Marin County compared to the state of California since the beginning of the pandemic, and illustrates that while we were hard hit as a community, especially certain groups in our community, relative to the experience of the state, thanks to the hard work of you all as a community and as of our partners, our case rates were significantly lower than statewide case rates at most stages of the pandemic. And on the bottom here, you see the policies that went into place that will be going away on June 15th, that blueprint that started in the end of August 2020. And you can see the colors, the tiers that corresponded to the case rates we were experiencing at each stage in the pandemic. And we are now in the yellow tier. We started in the yellow tier last week and will remain in the yellow tier until June 15th. Next slide, please. Looking back at testing, testing has been one of the key strategies for us all along, especially in the early days of the pandemic. We know that there was a serious lack of testing resources early on, and it was really the relationships that were forged around trying to tackle the problem of lack of testing resources really served us well at every step in the pandemic that followed, including our vaccinations. So we've now tested over almost 500,000 people, or 500,000 tested PCR tests, a lot more now, new testing technology, antigen testing, public health, healthcare partners, fire, critical partnership with fire, and volunteers from across the community really came together. And those have been the rails that we've been riding on through our vaccine distribution plan as well. Next slide, please. Well, I want to thank Leah Vermeulen for that beautiful photograph and some other of the black and white photographs that capture some of our work together. This is our testing rate, so it just shows that in Marin we've had significantly higher testing rates than the state averages. Really right off the bat, we had the first drive-through testing site established here in Marin at the Marin Center, and that Marin Center became our main site for vaccinations as well. Next slide, please. This is our hospitalization rates in Marin relative to the state and the nation, and shows that, right from the start, our hospitalizations were, despite having higher testing rates and higher ascertainment of cases, our hospitalizations were lower and remain lower than the case rate, statewide case hospitalization rates at every stage of the pandemic, and about 1/4 of the rates nationally. Next slide, please. And then most importantly, this is our mortality data. Marin County has demographically the oldest population in the state. And so we knew that we were particularly vulnerable to higher death rates because of the relationship between age and mortality for COVID-19. Despite that, because of, again, the hard work of everyone, we were able to really manage mortality so that our mortality rates were less than half of the state, despite the fact that it's a tragic loss of 184 of our residents in our county. Next slide, please. So now I'm going to get to vaccinations. This is a picture that was taken from my office at the Kerner campus in the Canal area as we are setting up the vaccine, the operation there with the tents for the recovery area in the courtyard of the Health and Wellness campus. And it was just a remarkable moment early in the morning when this double rainbow appeared over that vaccine operation that was about to bring the promise and hope of vaccinations to that most hard-hit Latinx community in the Canal area. Any promises that were made, on that day, I think we delivered on some of them, on most of them. Next slide, please. This is our vaccination rates as a county, 79%, as Supervisor Verdoni indicated, the highest vaccination rates in the state. Next slide, please. And then it just illustrates that the highest rates in the state for 1 dose. Next slide, please. And also the highest rates in the state for completed doses. Next slide, please. The most recent effort for vaccinations has been around our adolescents, and we set a goal to vaccinate at least half of our 12 to 15-year-olds within the week that they were first authorized when that became available. About 3 weeks ago, we were successful, vaccinated over 7,000 in 1 week of our 14,000 12 to 15-year-olds in the county. And what this slide shows is, characteristically now, we're seeing that Marin still remains the most highly vaccinated group now for that younger age group. Next slide, please. This reflects our effort to have equity as core to our vaccine distribution plan, looking at racial equity especially. Proud that our Latinx community that was most hard hit by the pandemic has the highest vaccination rates. This slide also illustrates that we have our lowest vaccination rates among our African-American residents. Only 71% have been vaccinated with at least 1 dose, which falls short of the county average. Having said that, it is still significantly higher than state vaccination rates for all groups outside of Marin. And that's an important strategic priority for us moving forward. Next slide, please. And then this is vaccination rates by age group, and importantly, our age 65 plus. The reason our mortality rates have declined so significantly is because we have protected now 98% of our residents above age 65 who are at highest risk for mortality have had at least 1 dose. Importantly, the two deaths we've had in Marin over the past 6 weeks, both of those individuals were not vaccinated. Next slide, please. And this is how, we've also tried to make sure that no community is left behind as we move forward with vaccinations, and we've been tracking this. And this shows that all communities, save one in Marin County, are within 90% of our average, of our top. So that means that none of our communities were falling behind too far. In our mobile operations and other operations, we're always going to try and catch up, help communities catch up if they were falling behind. Marin City has the lowest vaccination rate still, and that's again part of our key strategic priority moving forward. Next slide, please. So June 15th, reopening California will be moving beyond the blueprint. No more tiers. All sectors and businesses will be fully open. No capacity limits. This is per the governor. Regulations. The regulations in what has been put forward as the new framework are really limited to very few settings. If you think about the tier framework, it was almost every sector had very specific regulations and guidance. That's changed, the whole paradigm shift to very few regulations, and it's really focusing now on principles of behavior and understanding your own personal risk and the risk of those around you. So the regulations are limited to mega events. That's 5,000 people indoors or 10,000 outdoors. Marin really doesn't have venues like that, so it doesn't apply to us as much. But in those settings, people, in order to attend events in those settings, would need to verify vaccination status or a test. Face covering is also an important part of the ongoing regulations. We will be following CDC guidance as a state, as well as Cal OSHA regulations for occupational settings. And I'll talk more about that in a minute. And then there's special settings, healthcare, schools, and public transit that will have their own guidance as well. Importantly, on public transit, facial covering is necessary regardless of vaccination status. Next slide, please. All right, next slide, please. So why are we ready to move beyond the blueprint? Hopefully I've helped set the stage for the answer to that question, which is we have very high vaccination rates. Every vaccinated person adds to our safety, and we're continuing to try and vaccinate that remaining 11% who are eligible, who are not yet vaccinated. We also have a relatively low virus burden. As Supervisor Verdoni said, 1 case per 100,000 residents in the past, per day, which is the lowest rates we've had. We have low hospitalizations and death rates now compared to the lowest they've been in a year. We're doing ongoing monitoring. Public health infrastructure has really ramped up, and we have close relationships with our healthcare partners and laboratories to really closely monitor. And then we have a responsive community that we have learned that our community can respond in a timely way when we need to respond to any surges and cases we might experience. Next slide, please. So post June 15th, mask use outdoors. So the good news is that we're no longer required to be covering our faces when we're outdoors, regardless of vaccination status. And that's based on what we've learned about the risk of transmission in outdoor settings and highly ventilated areas. It's really more indoor transmission that we're concerned about. So it's a personal choice. There is no mask use required if you're not having symptoms outdoors. And obviously we need to respect one another's personal choices in that setting. Many will choose to continue to cover their faces and some will choose not to. And that's just going to be a matter of etiquette and how we move together as a community. Next slide, please. Indoors, and this is changing. I had hoped for this meeting that we would have a clear answer from Cal OSHA. They had a meeting last night where they decided they still weren't able to actually come to consensus around what the guidance will be. That they now have a meeting scheduled for June 17th, where they will come out with their new guidance. So what I can offer you is what is provisionally the rules, but again, it may change. Another signal that we'll need to continue to communicate with you as our community as we learn more about what the regulations will be post June 15th. Right now, it's looking like unless everyone in an indoor space is fully vaccinated, both staff so staff who are vaccinated and unvaccinated will need to cover their face indoors. So anytime you're in an indoor setting, unless everyone around is verified to be unvaccinated, everyone will need to continue to cover their face. With the exception in settings where you have workers as well as customers or the public coming in, if there are customers who are vaccinated, because they're not covered under Cal OSHA, and because the CDC says that they don't need to cover their face if they're vaccinated indoors, customers may choose to remove their facial covering if it's allowed by the business. And this will be determined business by business, whether or not they have an institutional policy to require facial covering indoors or not. Next slide, please. What's next regarding variants? This is, if I'm thinking about what I'm most concerned about in terms of our ability to reopen and stay reopened safely without having to impose any further regulations, it would be around the variants. And this is just our data. We're doing aggressive testing of now almost every sample in Marin County for the whole genome sequencing to determine which variants might be circulating in our community. And now we see that that B1617.2, which is now called the Delta variant, that's the variant from India. It's now global, but it was first found in India. That's the predominant strain in Marin County. 17 of the past 31 strains that we've typed are that particular strain, 55%. And it is more infectious even than the UK variant, which is now called the Alpha variant, the B117. And so we are monitoring that very carefully. Fortunately, the Delta strain, the vaccine is highly effective against that strain. So we are well protected through the vaccines that we have available to us, and at almost 90% vaccination coverage. I'm confident that we're not going to see significant outbreaks due to the presence of the Delta strain in our community, but we'll be watching this very closely. And it's a signal that this may be an ongoing concern for us if new variants emerge. Next slide, please. And this just shows the presence of that variant. The green is the Delta variant. We're seeing that that's much more highly present now and currently compared to the past. Next slide, please. What's next regarding boosters? We get a lot of questions about whether or not going to have booster shots. The answer is maybe, for two possibilities. One is if it's waning immunity. So if our immune systems actually lose that memory through the vaccine and are more susceptible again to COVID-19 infection, we might need to have a repeated dose of an existing product. So you might need to come in for a third dose of the Pfizer or Moderna. Or if there's new variants, as I mentioned, we might need a new vaccine that has a different formulation to match the genetics of any new variant that might be circulating. It would likely be one dose. And the good news is that with our success of the current vaccine distribution plan and the partnerships we've forged, we're ready to move forward with boosters if and when that time comes. It would likely be fall at the very earliest. Next slide, please. And this is another photograph. This one's from Bolinas. Just, I think, captures the spirit of Marin and how we've responded to this pandemic together. Free masks. Thank you, Marin. And I'll hand it over now to Dr. Lisa Santora, Deputy Public Health Officer, who's just been an amazing asset to us as a community, and has brought so much of her experience as a mother and as a physician, and as an advocate for our children, especially in schools, to this work. And she's going to talk about what's next for schools. Thank you.
Thank you, Dr. Willis, and thank you all. I'm really proud of so much about our response, and you saw the successes that we've had with our data and keeping case rates low and vaccinating and always keeping ahead of the COVID curve as best as we can. But what I'm most proud of is our efforts in partnerships with schools across the county, private and public schools, institutions of higher education, our Marin County Office of Education, administrators, staff, and parents all working together to get our schools open. And we have achieved something that most other counties and many other states have not achieved, is that we approached almost 3 million student days, where students were in school, in person, with other students and their teachers, and learning. And that is the best environment for students, and that's where students thrive. And it was a tremendous amount of efforts on many parts. Thousands of people worked to get schools open in Marin. I'm so proud of that effort. And I'm also very proud is that with so many days, we demonstrated best practices and led the nation in implementing strong infection prevention and control models at the school level. And we're able to keep the number of cases among students and staff down to less than 20. So almost 3 million student days and less than 20 cases. And that last blip that we saw, we were holding at 12 cases, was because of an outbreak among unvaccinated individuals who are not eligible. It's our under 12 population where they had contact in the school, and we had a blip at the end. So it just, to me, reminds us that we still are at risk. There are variants circulating that appear to be more contagious, but there's so much that we can do. And also that we showed that there were still, despite that outbreak, there were no students to adult transmission. So that schools are a safe place for teachers and staff to be, that schools are the best place for students to learn, and I'm really proud of that. So you can jump to the next slide. So what's next for schools? Although my children today were singing schools out for summer, it's not out forever. According to that song, it's opposite of that. We are absolutely going back full-time and opening schools this fall for full-time in-person learning. We actually have some schools operating over the summer as they are helping students catch up with their in-person instruction. So we are still working over the summer, even, and many schools are still working over the summer to support education and support decreasing that educational attainment gap that we are so concerned about when schools closed. And now we're seeing a major shift in the state, where the state will be aligning with Centers for Disease Control and Prevention guidance. We'll have updated guidance from both CDC and California Department of Public Health. And we'll be seeing continued universal and correct use of masks in our school settings. At this point, we're still recommending, this is from the CDC's physical distancing. At the school level, it's been reduced to 3 feet between students, but that's where we still are now. We are anticipating a change. Just going back to the basics, face coverings work for students, but also the basics of washing your hands and covering your cough, making sure we have adequate cleaning and ventilation. We don't believe this disease is transmitted by fomites, so the deep intensive cleaning that was recommended before is gone. Those days are gone. It's just the regular cleaning, but we are working with the schools to ensure enhanced ventilation, especially as we prepare to move into wildfire season and know that we have some poor air quality days ahead of us. And again, just continuing the strength of our partnership with the schools and public health. We have an amazing team of nurses on our schools teams that have been working with childcare in schools since the beginning. Since although schools closed in March, our childcare providers stayed open and assisted with contact tracing and ensuring that we isolate and quarantine. And that's where we really can be very effective. We were able to contain an outbreak to 2 grade levels and not spread throughout the school because we identified cases very quickly, and we're able to quarantine classes and stop the spread of disease and stop an outbreak. So you can jump to the next slide. And that's just a slide of our teens getting vaccinated, which again was a great day. Our success again in Marin County and why we've excelled in vaccinating the 12 and above population is again that partnerships with the schools. We hosted vaccine clinics at school sites across the county, really focusing on those low healthy places index quartile communities, ensuring that the lowest income communities in Marin County and communities of color had access to vaccination as a priority. So we are continuing, school is still in session, like I mentioned, for many students across the county. We have our public health liaison program. This is a program where we had more than 28 meetings where almost over 100 school staff every week met with our team to learn what tier we're at and what is the new guidance around tiers and decision-making trees. And they're just an amazing group of people that really were the core of keeping our schools open. We're waiting guidance. We're always in the watchful waiting mode as we wait to see what CDC and CDPH guidance will be. We are implementing new testing strategies. We already piloted that last week. We have a new data management platform for testing on that Binax card, which is actually something you can buy at CVS today if you want access to testing. It's almost just about $10 per Binax card now. But we have building a program with our schools. So for that unvaccinated group, especially our elementary schools going into the fall, they will not be vaccinated, and to have access if there is an outbreak to Binax testing, or if a child develops symptoms during the class, during the school day, they'll have access to Binax testing. So we'll be piloting that throughout the summer. And again, we are anticipating our masking guidance that all staff and students at all school levels will be wearing their face covers indoors as they're on the bus to schools, although there won't be capacity restrictions on the buses anymore. They're going to have to wear their face coverings. But the good news is that there'll be free time outdoors. So when students are outdoors, they'll be have some mask free time. So you can jump ahead. So I'm a family with children who are unvaccinated. So we still have to move, those families still have to move a little bit differently or more cautiously. We're not as free as some of the families with just teenagers who are vaccinated. And so we still have to be aware that just like I described the outbreak in that elementary school setting, that is a reservoir for COVID. It's a pool for COVID activity in our community. And so we really do want to limit the time that our unvaccinated children spend in indoor public settings. If they're indoor, they should be wearing a mask, but there'll be mixed communities in many indoor settings. I'm really trying to avoid crowds and confined spaces. I always say, I think on every call, COVID hates the outdoors. So that's the best place to spend time if you're have unvaccinated children, and it's probably the healthiest place for them to be. Always wear a mask indoors when in public and around other households, and really be considerate of your children's exposure to older adults. Although we see tremendous vaccine effectiveness as you're older, there's an increased risk for a breakthrough case of COVID-19. So really limit that close contact with older adults and people who have high risk medical conditions. And I can't say it enough, it's good for all of us just to optimize our time in outdoor activities. So when selecting camps, select camps that are spending more time outdoors, and even if you're going dining, if you have an unvaccinated child, to consider choosing the outdoor option rather than the indoor option. They still, for children under 12, and for all, we recommend people getting tested if they develop any symptoms of COVID-19. My parents went away and traveled to Texas and were around people who were both vaccinated and unvaccinated, came back with a cold. My first recommendation is go get a COVID test. And my parents were like, well, my mom was like, well, I'm vaccinated. I'm like, no, get the COVID test. That's where we can identify those breakthrough cases and prevent any additional spread. So she was negative. That was good news. And then just ensuring travel-based testing. Stay up to date with the CDC guidance when you're going to be traveling over the summer. I planned my family trip back to Jersey, and it was supposed to be Italy, but Jersey instead, and had to plan the return of our end of our travel to coincide to give the time for quarantine before my children return to school, and to make sure I have time to get my 2 children who are under 12, since they have traveled, unless it changes, to get tested 5 days after that travel, and then to stay in quarantine for a full 7 days. So even though school's out, just really be prepared and stay up to date on the CDC travel guidance, because that is what we would expect when students return to school. And we went all kids in person on day one of school and not to be unnecessarily Zooming or to be missing school because they have to complete a quarantine. So just really be aware of when school starts and plan backwards. Jump to the next slide. And I can't speak enough about this topic. This is a topic that impacted my family significantly, is that 15 months is a really long time in a child's social development. And a lot of children and adolescents in our community really struggled with higher levels of stress, worry, and anxiety. And this is where parents, what we're seeing is this is a rebound time. We all hunkered down. We just, buckled up and got through the school year. And now we're starting to see where people are finally opening up, their emotions are opening up. They're having some challenges on their interactions with other kids or with their siblings. And that, from what is natural, they're not in survival mode anymore. And so some of the behaviors that they were holding on to, they might be releasing right now. So the best thing to do with your children is really just talk to them and see how they're doing, help them identify and name their emotions. So they're not, they're not just acting out, help them identify what's happening and talk about it, help them build social connections. Many kids were in different stages of their development and have to learn how to make friends again. And that you can play a role in that by setting up outdoor play dates and helping them maintain their connections during the summer and engaging them in activities. And again, just like I described, planning family trips and building time outdoors in your days. A lot of parents, working parents, are going to be returning to work, and you're going to have to make time to schedule that time for your family to spend together, and again, to start helping your children heal from a really tough 15 months. So if we have resources at the county, if your children or adolescents are struggling, we have a helpline and we can make that available on our chat. But I'm so thankful for our community. We have excelled because we work together, and thankful for all of our partnerships. I think Dr. Eberhardt is next, and Kaiser's been one of our greatest partners. And I'm going to pause because Lainey might correct me if Dr. Eberhardt is not next.
She's next. You're right on.
Okay, and I can't along the way,
great part.
So we're going into our nursing homes we managed over 104 outbreaks in our nursing homes. We had tremendous healthcare partners from Kaiser, Marin Health, and Sutter, who are all willing to go and learn together how to best respond to this unexpected pandemic that landed on our laps last year. So thank you, Dr. Eberhardt, and your team.
You're welcome. Thank you, Lisa. So I'm really honored to be here, Laura Eberhardt, and although I work for Kaiser, I think that what I'm going to say today represents what my clinical friends and colleagues across the county would say. So what I'm saying is not KP specific. You can go to the next slide, please. So 2020 was definitely a year that felt like a century, and I want to start and end my talk with a little bit of gratitude. And my beginning gratitude is to honor my friends and colleagues in healthcare. And this is really not a time that we want to look back today too much, but I do just want to talk about the silver lining of the pandemic for a lot of us in healthcare. It really was an opportunity for us at KP, at Marin Health, Novato Sutter, Marin Community Clinics, to work so closely together all year long, from the uncertainty of PPE, which is a term that we had never heard of before last March, through the San Quentin outbreaks, the super difficult surges in the hospital and the concern about how we were going to keep all of you in the community safe, and the wild rodeo of the early days of the vaccine era. I want to tip my hat to all of my fellow clinicians, and in particular to Dr. Santora and Dr. Willis, who taught all of us so much about public health. Next slide, please. So a number of us have not laughed, but sort of commiserated that COVID is mostly science. The advice we give, mostly science with a good dose of kitchen table wisdom, and a fair amount of giving the best advice we can in a shifting environment. Again, the clinical thoughts I give today, I think, are sort of conversations with clinicians across Marin County and UCSF. The good news, bad news, Dr. Willis touched on this quite a bit. The good news is that the vaccines are exceptionally effective. The bad news is that they're not perfect, and we knew that going into this. They're actually a lot better than we thought they were going to be. But the good news, other side of the sandwich, the other piece of bread, is that if a vaccinated person gets COVID, they're very unlikely to get seriously ill. So we're in such a better place right now than we thought we would be a year ago. Who still needs to mask? I think both Dr. Willis and Dr. Santora touched on this. I'm just going to say it maybe in a little bit different words so that all of our comments layer together and hopefully it makes sense to everybody. People that are not vaccinated need to be masked. And again, these are medical recommendations. They're not political recommendations. They're purely my clinical recommendations. People who are not vaccinated need to continue to mask, both to protect themselves and to protect people around them. You just don't know if the Safeway checker or the Trader Joe's guy that's moving stuff around on the shelves is vaccinated, or if they might be immunocompromised. So it's something that we do for our whole community as well as for ourselves. People with a compromised immune system, and by that I mean people that have had an organ transplant, people that have gotten chemotherapy recently, people that are on medications that suppress their immune system. Generally, your doctor will tell you if you're on one of those medications, they should get vaccinated. And they should, and this sounds kind of odd, but they should kind of assume that they're not vaccinated, in that their behavior should still be really protective of themselves. And people, similarly, people that are in close contact with somebody who's got a vulnerable immune system should practice those same more careful personal practices. It's okay to keep masking indoors or frankly outdoors if that's what you feel most comfortable with. It's not going to be required at a certain point, but I think we're all kind of easing back into the water. It's going to be a little tricky to figure out what to do when you have the sniffles or a sore throat or an ear thing. I would say if you have allergy symptoms, for example, I have dust mite allergies. I know what that feels like if I've got a Deborah Winger voice in the morning or what have you, sneezing a lot. I know that that's my allergies. I don't have to get COVID testing. However, if I have a new, we're going to get new colds because the kids are back in school or they're going to be playing with playmates and at camp this summer. So if I or somebody in the family, as Dr. Santora just said, have cold symptoms, I would take those seriously. Back in the olden days, by which I mean pre-COVID, if any of us healthcare providers had the sniffles or had a sore throat and we felt well enough to come to work, we'd wear a mask. I would recommend doing the same thing now if you have cold symptoms. I think that's going to be a change that I'd like all of us to think about. So if I have a scratchy throat and I don't feel, this is not COVID, I'm still going to wear a mask for a couple of days around my friends, family, and colleagues when I go out to the store, just to protect other people. If I really think that I have symptoms that are suspicious for COVID, so if I lose my sense of taste or smell, that's the cardinal one that everybody knows now. If I'm ridiculously fatigued, if I'm getting fevers that have no reason, I think everybody knows kind of the cardinal symptoms of COVID now. Get tested. And until you get that test back, you should be protecting yourself or protecting your family and others by wearing a mask. Travel. I think that Dr. Santora talked a little bit about travel. We all want to travel. My ID chief says there's a phenomenon called revenge travel these days, meaning we're making up for 2020. Even though I'm still vaccinated, I think I'm personally going to over-mask when I travel, even in areas where they don't necessarily require masking. The CDC has really good travel resources, and personally, I would avoid hotspot areas, and those change all the time. They have been India. Great Britain is having a thing right now with the 1617 variant, Brazil, Peru, South Africa. So that list is going to keep shifting, and I would pay attention to the CDC site if you're planning to travel. Next slide, please. I think that Dr. Willis talked about most of this. The point I want to bring up is, again, some of my ID colleagues have brought up this specific idea that we are winding down, turning the page on the pandemic, but we're not eradicating COVID yet. So we're still going to be living with it for quite some time. And the disappointing idea, as we're starting to celebrate into the summer, is that we may see a spike in cases in the fall. And in our county in particular, because we're so well vaccinated, we are expecting and hoping that that's going to be an outpatient spike in cases and not a hospital spike in cases. So there's this phenomenon that's called uncoupling or decoupling the infection surge from the hospital surge. We're still going to have new variants coming into the county because Marin residents like to travel and people like to visit our county. So we'll still be getting a little spicy flow of information from the IJ, the Chronicle, and the Department of Public Health website about what variants exist in our county. And as Dr. Willis said, we just don't know yet about boosters, so we'll let you know that when we get that information. Next slide, please. Okay, is it safe to come into the medical office? In a word, yes. I think that people have been so concerned for so long about the safety of coming here that we've we've really put off a lot of priorities that would otherwise be important to us. During 2020, providers across every single healthcare entity, from UCSF to all of the Marin providers, got really good at talking on the phone and doing video visits. And some of that is actually really good. I think our members and all of us as patients have found that really quite handy, especially if you work. So a lot of that will stick around. There's a lot of benefits to that. However, sometimes you just got to come in. You might need an x-ray. You might need somebody to listen to your lungs, somebody like me. You might need labs drawn. You might need a procedure. Those are safe. In fact, these environments have been some of the safest throughout the pandemic because everybody's been using PPE like crazy, and it's so highly vaccinated here, and our county is so highly vaccinated. You'll still see symptom screening at the front door, I think in every clinic or hospital that you come to. If you have any viral symptoms and you're expecting to come in for any services, really anywhere in the county, but I'm going to talk about healthcare offices in a minute, please contact your doc and think and be thoughtful about what's the best way for me to enter that healthcare environment. So if I'm going to go get an x-ray because I've got new shortness of breath, or I'm going to go get some labs drawn or what have you, talk with your doc about what makes sense. Maybe if you have symptoms that are suspicious for COVID, they might actually have you met at the front door and sort of escorted as a quiet VIP down to wherever you need to go. So I'd ask you to be thoughtful about that and not wait until you're confronted with that symptom screening at the front door. For now, testing before procedures and surgeries is still required. We think that's probably going to change. So the California Department of Public Health is coming out with new recommendations, and so we may expect to see that change fairly soon. Next slide, please. What are healthcare providers doing to stay safe? We are still required, I'm alone in my office now, so I don't have to wear a mask, but we're still required to wear masks and eye protection when we're in in-person encounters. Symptom screening we just talked about. We are also symptom screened when employees at the hospital come through the front door. We're doing more video and telephonic visits if it makes sense. However, I encourage you, if you feel like you need to be seen, to make sure that you make those needs known, whoever is taking care of you. And healthcare workers are taking steps to practice some healthcare for themselves, some self-care for themselves. Many healthcare workers that I know didn't take time off from March 2020 well through March 2021. Many of us stopped exercising. We saw our friends and neighbors and colleagues in the hospital, and it was some of our greatest fears not to see them in the ICU. And there's a deep exhaustion from the accumulated stress and grief of that. And so this is an important part of our communities coming back to normal, to see our healthcare workers starting to get back to their normal lives also. Next slide, please. Let's talk a little bit about testing and vaccination. So COVID testing will continue to be available for the reasons that I just told you throughout the county. And those, I think that Dr. Willis told me personally, and he'll probably reiterate this at some point, that those resources will be available on their site. You can see where you can get testing done. This is the one place where I'll say KP-specific information. The KP COVID testing is going to be moving from our parking garage over on Los Galmos back to our Tierra Linda campus. And so the testing and the vaccine sites will be side by side, one in the morning, one in the afternoon, and appointments can be made online, on your phone, on your computer, or by calling the call center. And we'll leave that at that. Next slide, please. So let's talk a little bit about the non-COVID impacts of the pandemic. All of us put off some important stuff: mammograms, pap smears, colonoscopies, screening for important illnesses like diabetes and high blood pressure, even dental, routine dental care. Many of us exercised more. Some of us exercised less. Sleep was disrupted. There was a lot more TV going on. I know that the Crown and Bridgerton got many of us through a difficult year. And there was a lot more substance abuse than we've seen in the county in the past. So I think as part of health and wellness, I want myself and my family and for all of us to think about those habits that served us well in terms of our health that we want to keep, and those habits that didn't serve us so well that we want to discard. Next slide, please. Let's talk specifically about mental health. And I am not a psychiatrist or a psychologist, but I did talk to a number of my colleagues across the county, and I've been doing some reading on this. Really important to acknowledge the loss, the stress, the isolation that a lot of us have felt. and the anxiety for both adults and for kids, as Dr. Santora just mentioned. It's really important to name it. So just really put a name on it. And people are even using the term PTSD, which I think is apt in a lot of situations. And it's normal to feel, even though things are better now and summer's almost here and things are getting better and June 15th is right around the corner, there's some anxiety about expanding our social circles and taking our masks off and going out into the world again, and that's really normal. Next slide, please. So what are some things that might help? It's really important to go at a pace that feels comfortable in terms of re-engaging. So you don't have to have that 30-person family reunion on June 16th. It's really important to acknowledge grief or loss if that's part of our personal experience, either for ourselves or acknowledging other people's experience. Then there's some habits, and this is where kitchen table wisdom comes in, reconnecting, getting outside, as Dr. Santora mentioned, moving, moderation in substances, and super important, if all of that kind of getting back to what seems like it should be normal is not helping, to get help, either from your doctor, certainly starting with your friends and family, going to healthcare professionals, and seeking a mental health care professional if that's what you need. Next slide, please. The last thing I'm going to end with is a couple of really nice articles. There's a disclaimer that I'm not a psychiatrist, by the way. A couple of nice articles that The Atlantic has put out over the last month or so on post-pandemic recovery. And that first one, and maybe Lainey, maybe you could put these in the chat because I don't think people can click on their screen and get to these. The first one is titled, What Happens When Americans Can Finally Exhale? And it talks about the mental toll that the pandemic has taken. The second one is titled, A Once-in-a-Lifetime Chance to Start Over, which I think is just such a great title. And it recommends kind of making for yourself a 2x2 table with the columns being what you like and dislike, and the rows being pre-pandemic and pandemic times. And giving yourself time to reflect on what to keep and what to leave behind. So I invite you to read those if you're so inclined. Last slide. One more slide. All right, I told you I would end with gratitude, and this is gratitude to all of you. This picture at the bottom was taken in December of 2020, and right after Thanksgiving, we were really seeing a spike in COVID cases in Marin, and all of us healthcare workers asked all of us in the community, all of you in the community, to stem the tide, because only you could do this before the vaccine could really take hold. And you really did. You really turned the tide on this, and I can't tell you how much gratitude we all have to you for that. I'm going to end there. Thank you so much.
And thank you, Dr. Eberhard, for that really helpful information and helpful perspective. And I hope all of you do take care of that preventative care that needs to happen in order to maintain a healthy lifestyle. So now I'd like to introduce our final speaker in this lineup, and he uses his law and public policy and business background to help local businesses thrive. He joined his local economic development committee before a successful election to his town council in 2017, and now he's co-chairing an effort to help Marin businesses survive and once again thrive with this pandemic. Hailing from the hamlet of San Anselmo, please welcome Mayor Brian Colbert.
Thank you, Lane. And that was the best introduction I've ever heard in my life. So that was great. I'm gonna use it. So I'm gonna talk about the next steps for business and economic recovery. I'm the mayor of San Anselmo. My name is Mayor Brian, and I'm here on behalf of the Marin County Council of Mayors and Council Members. I'm going to briefly touch about the role of the MCC. Then I'm going to talk about the key stakeholders and the economic development efforts in addressing the immediate challenges of COVID and planning for economic recovery. Then I'm going to talk about silver linings or the lessons learned or some things that we as a community might like to retain that we've learned in COVID. And then I'm going to close with, what does the future hold? So the MCC, it consists of all the mayors and council members of all the incorporated towns and cities in Marin. We work on issues such as housing, homelessness, and sea level rise. Next slide, please. And then in April 2020, after the onset of the pandemic, Mayor Kate of the city of San Rafael and I formed the Economic Recovery Committee. Next slide, please. And the recovery committee is focused on 1 or 2 members of each of the cities and towns. And the focus is to address the immediate challenges of COVID and chart a path to economic recovery. We've been meeting since the advent of the pandemic every 6 weeks or so. Next slide, please. And we've been focused on facilitating a vital exchange of information, best practices, and policy initiatives among a number of key stakeholders in the county. And I'm just going to cover a few of them. Some of them have been the Marin Economic Recovery Task Force, led by Supervisors Damon Connolly and Judy Arnold. Marin Recovers, and that's the websites that acted as a clearinghouse of information and updates about the Marin County reopening plan. Keep Marin Working. That's a collaborative of different Marin organizations focusing on coordinating and strengthening the voice of business throughout the county. Next slide, please. We've also been partnering with our local chambers, and I can't say enough about how they stepped up during the pandemic to rally community support and provide immediate financial assistance to our local businesses. And of course, we've been working with our cities and towns, facilitating best practices and working collectively so that each of us can maintain and augment our own unique sense of place. And finally, we've been working with another variety of stakeholders in our county. Next slide, please. So the pandemic has been and remains an incredible challenge for so many of us here in our community. Yet that said, there have been a number of silver linings. And by silver linings, I mean, what lessons have we learned and what aspects of our community do we want to keep up or build upon as we enter recovery? Those include slow streets, a focus on community, social infrastructure, supporting our local businesses, and a renewed appreciation for public space. I'd like to draw your attention to the 3 photos on the slides right here. All of these are taken in downtown San Anselmo. The photo on the left is a brand new common space that we have, Creekside Commons. And in front of it is our downtown streets, which we closed last summer on Fridays and Saturday evenings, and we'll be doing again this summer. The middle slide shows one of our local retailers, which has also begun to sell food, and one of their parklets in front. And the final slide is the parklet from the interior. So some of the things that the pandemic brought to the fore, some of the things that I think all our communities really enjoyed and want to build upon are a focus on community. As has been discussed before by some of the earlier panelists, human interaction has been so critical and took a dive during the pandemic. People in Marin want to reconnect with each other. And part of that reconnection has meant a renewed appreciation for public space, particularly in our city centers. The ability to connect with our friends and neighbors in either planned or spontaneous gatherings is important. We've also talking about slow streets, the ability to walk and bike everywhere. I've never seen more families enjoying walking and biking in our community since COVID. That's something that we want to all try and keep. One of the things that we've really focused on is supporting our local businesses. Our residents came out in droves to support our restaurants and our retailers. We want to figure out how to continue to do that in a sustainable way. And last but never least is social infrastructure. A lot of people think it's just parklets, but how can we design our public and encourage our private spaces to encourage all kinds of activity, social and economic, to take place outside? Next slide, please. So at MCCMC, we've been hosting and sponsoring a series of symposiums to capture these trends and provide a jolt of high-level economic development energy to keep moving forward. Our first symposium was last month, and that focused on collaborative city making and restaurant trends. Restaurants look different during the pandemic, and those changes are continuing to improve their development. How can we act as policymakers and communities to take advantage of this? The next symposium, which will happen in the latter half of June in a couple of weeks, is the relationship between our brick and mortar retails and the future of e-commerce. Many people began using a lot more of e-commerce during the pandemic. How do we help support our brick and mortar retailers, which provide a unique sense of place? Future topics will include how to incubate and attract high growth industries here in Marin. And lastly, how do we explore creative mixed use energies to continue to provide energy to our downtown and commercial corridors? Next slide, please. And lastly, what's the future hold? I have to say, under the leadership of Dr. Willis and his team at the Marin County Department of Health and the hard work of our community, including all the sacrifices that they've made, this is the perfect time for us to re-engage socially and reopen all sectors of our economy. I'm going to encourage everyone on this call and elsewhere to engage in a civic dialogue to help us shape our collective future. And what might that future look like? Well, the county, in partnership with the Marin Economic Forum, has been working to secure a grant from the Economic Development Administration to develop the first high-level economic development strategy in the history of Marin County. This is incredibly exciting news. I'm also aware that some cities and towns are also beginning to think about creating and executing their own post-COVID economic development plans. And what might those economic development plans contain as we look to the future and Marin Economy 2.0? There's going to be a focus on localism and tourism, continuing to support and encourage vibrant downtowns that meet the needs of locals and tourists alike. Sustainability. Unfortunately, sustainability took a hit and a backseat during the pandemic due to public health concerns. It's important that we re-embed principles of sustainability and Marin Economy 2.0. Workforce development. We need to continue and improve opportunities for our workforce to develop the human capital to provide work and so that they can work with dignity. So we can creatively and address, we also need to work to creatively address the worker shortage that our local businesses are now facing. Many businesses in Marin right now are seeking to reopen to peak or even greater capacity, and they can't because they simply can't find workers. We need to work collectively to figure out how to address these problems. And finally, as part of the Bay Area, we need to work to continue to create a business climate to encourage and support entrepreneurs here in Marin County. And with that, I'll draw my remarks to a close. Thank you.
Thank you for that, Mayor Brian, and thanks for sharing not only that great insight on what's to come, but those helpful resources as well. Now, as we wrap up, I want to share with you some communication resources to guide you in the weeks to come. Next slide. Now, as you heard, there's a lot of things that we do know, and there are many things that we still do not know and are waiting on the state to finalize, whether it's those potentially revised OSHA guidelines, as an example, and as well as school guidance and summer camp guidance. So I wanted to bring to your attention a few state website resources that will be your source of information as these things are finalized. So take a screenshot or a photo of this, if you will, so that you have these websites handy. First is the state of California's website at covid19.ca.gov. Many of us have become very familiar with the site during the blueprint, and it will remain kind of a centralized hub even after the blueprint goes away and we enter that beyond the blueprint phase. Second is the California Department of Public Health website. This is where a lot of those guidelines around masking and other things will be located as those things are as they are finalized. And then finally, of course, awaiting Cal OSHA's decision, this is going to be a great resource for employers as well as employees on what will be permitted in the workplace. Next slide, please. Of course, your source for ongoing Marin-specific information is, of course, our primary webpage, coronavirus.marinhhs.org. We also have our status update publication, which 37,000 of you subscribe to. Thank you for that. It's currently published 5 days a week and will shift to a weekly publication later this month in order to provide you with ongoing a high-level overview of the remaining COVID-19 activity and updates that are occurring in Marin. And of course, keep in mind that things remain dynamic in this response. So we commit to increasing that frequency of that publication as needed for the sake of ongoing transparency and keeping all of you informed. So with that, we have technically reached the duration of our event, but I have secretly chatted the remaining panelists to see if they can hang on a few more minutes to see if we can address a few questions that have come into the Q&A portion of this very quickly. I know some of the questions have been answered by our panelists already, so thank you for that, panelists. So let's see if we can tackle a couple questions before we have to wrap up. So the first question, Scott asks, under the state's new paradigm, when businesses choose to comply by providing information about the whole, vaxxed versus vaccinated, masking rule. And of course, we're still waiting to see what's going to come out of the potential Cal OSHA revision. If they rely on self-attestation, what exactly qualifies as self-attestation? Can we say something like, here are the rules, here's my sign that's posted, and by entering my building, you attest that you are in compliance? Any legal minds on our panel want to address that one?
Yeah, I can start. So the state does not indicate the method by which you determine vaccination status. And it's from the honor system. I think the simplest method is signage that indicates what the rules are, and then you make an assumption that if people see that they're, by entering and not covering their face, for example, that through the honor system they're understand and are complying. That's a form of self-attestation, and then you can ramp up from there. There's nothing that prevents, as I said, for the mega events, they're actually formally required to verify their vaccine status through through actually showing a vaccine card or some other method. So there's a continuum there, and it's up to the individual establishment to determine the method.
Okay, thank you for that. Here's a quick medical question, although this one may have been answered, but I think it's good for everyone to hear. If a person has an antibody drawn and their antibody test shows that they have immunity, is that as good as a vaccine in terms of the whole masking and distance compliance? Dr. Laura, I don't know if you want to tackle that one.
Yeah, no, it's a great question, and I can see why people might think that it is. You might have waning antibodies from a prior COVID infection, but that is not necessarily enough to protect you from a new COVID infection. So it's not as good as getting vaccinated. I would not use that in lieu of getting vaccinated, nor would I accept that as proof of vaccination.
All right, thank you. Well, you guys are answering the questions already, so I can't even keep up. Thank you for that, Dr. Willis. I'm going to jump into the question that you're answering right now. So can a business require proof of vaccination in a indoor public setting? Maybe that's a library or our own civic center or something like that, or maybe the San Anselmo Town Hall.
Yeah, that's a question, for a business. Yes, you can require vaccination for sure. Any business can say that, unless you're vaccinated, you can't enter. I mean, that's the prerogative of a given business. Where it comes to public gatherings, I don't know the answer to that, because that's obviously a civic responsibility that every citizen has a right to participation. And we would have to ask the state whether or not something that is a public event can restrict it based on vaccination status, or whether or not there would have to be a separate area or mandatory face covering, but still permission to attend.
All right, next question. Houses of worship were a hot topic during the blueprint for the safer economy in terms of changing indoor capacity and what was allowed, what wasn't. So, and this beyond the blueprint model, what happens for houses of worship? Are there still restrictions in place there?
No, I mean, this is the new world. So there are no formal restrictions. So the only restriction, if it's less than 5,000 individuals, you're relying on an understanding and internalization of the principles of safety and responsibility. So, I think that the assumption on the state's part, and I agree, is that at this point in our pandemic experience collectively, we understand a lot about this, how this virus is transmitted. We understand the principles of social distancing. We understand the risk of indoors. We understand our own personal risk based on age and other factors, chronic medical conditions, et cetera. We understand the value of facial covering. We understand the value of vaccinations. All that information is available and known. And it's up to us to take that together and navigate decisions that we're facing within our own lives. And as institutions, to organize our regulations and our protocols to follow those. It's not going to be the California Department of Public Health instituting requirements to prevent those choices. So houses of worship would be permitted to open indoors at any capacity.
Okay, that's helpful. I'm sorry, Dr. Lisa wasn't able to stay on with us, but perhaps you or one of our other qualified panelists can answer this. So, according to what the state has put out about Beyond the Blueprint, masks will still be required in those indoor youth settings like K through 12 schools, childcare, just as general youth settings. But what about those other potential youth settings, say a library or an indoor family miniature golf setting? Do the rules still apply in those unnamed areas? Or is that one that's kind of a TBD with the state?
Masks will continue to be required for vaccinated peoples indoors if it's outside of your household. That's one of the sort of the known elements of the that's the CDC moving forward post June 15th.
Because that would be
Unvaccinated.
Yeah,
unvaccinated people. Yeah, sorry. Thank you, Laura.
Right. And also we got to remember that it's, where there are mixed groups, some unvaccinated, some vaccinated, and many children are too young to be vaccinated yet, right? And so we have to take that into consideration as well. Excellent. All right, I think we have time for one more question. And real quick, before I ask this, if anyone didn't get their question answered, I do want to remind you that we have our COVID-19 response team on standby. Alex, I think you have a slide for this. It is COVID-19@marincounty.org. They would be happy to answer any questions that we didn't have time to answer either in the Q&A chat here or verbally. So keep that in mind, and they'd be happy to get back to you. So one last question. As it relates, well, how about this? And this is kind of a what if question. So if Cal OSHA decides not to change their rules on masking, and the governor decides not to override, use his executive power to override it, will Marin decide to follow the Cal OSHA or the CDC guidelines? How do you tackle that, Dr. Willis, from a policy perspective?
Yeah, the Cal OSHA regulates all workplaces in the state, regardless of county. So that's an area where we would not have county-specific authority to override that ruling. So we will be, businesses within California will be following Cal OSHA regulations. I imagine that I'm anticipating that there will be alignment between the CDC and the Cal OSHA guidance. I think that's why it has taken so long for Cal OSHA to actually finalize, because when they came out with conflicting guidance between Cal OSHA and CDC, there was confusion and pushback, and it led them to now have another meeting. And the goal of that meeting, as I understand it, is to find a way to reconcile those two so it's less confusing for us as a community and safety.
Okay. Thank you for that. And I lied. I'm going to squeeze in one more question because it caught my eye given Supervisor Rodoni's discussion about equity at the very beginning of this session. As things lift and open up, how are we, I assume the county, maybe this means Marin Public Health, maybe it means us as an entire community society, how are we going to continue to ensure equity in the areas and among the ethnicities that have the lowest vaccination rates?
I can give that a try, Lainey. I think before the COVID, equity at the county was one of the priorities of the Board of Supervisors. The pandemic just demonstrated how much we need to move that forward and that program forward. So throughout the pandemic, we really begin to understand how to address many of the issues in our communities of need and our communities of color in particular. And like I talked about, bringing them services in a culturally sensitive way was something that we learned that lesson with the pandemic outreach, and it really worked well. We see the results of it working well. So, we're committed at the Board of Supervisors and at the county to continue that movement to make sure that this doesn't happen again to our low income communities when the next emergency comes along. And it could be a variety of emergencies, not just a pandemic. But we've learned a lot, and now it's for us to take that lesson and move forward.
Lainey, can I offer an example of that? So just
Sure.
today, we were having a conversation with the Canal Alliance, which is a community-based organization in the canal. They're recruiting from people who live in that community initially for helping us with our contact tracing. We knew that we needed bilingual, culturally relevant voices and trusted voices to navigate those conversations around people who are infected in quarantine and isolation, to offer them resources. Now that need has diminished based on lower case counts, again, our rates among our Latinx residents are far lower than they are for the average for the county. That same pool of workers that were recruited for that are now being shifted into work for rental assistance, because now we know that the consequences of the pandemic is that there's a lot of people who need assistance have gotten behind on rent, and the eviction moratorium has been an important protection for them. And now offering rental assistance, there's funding for that, but we need to help people navigate to those resources. So that's an example of a relationship directly with members of that community that have transformed from the COVID-19 response directly to now dealing with the recovery.
Thank you for that. That's a helpful example. Well, I wish we had more time, and I do want to thank all of our panelists as well as all of you watching for hanging out a little longer, and also to our wonderful interpretive team and accessibility team for making sure that all of our residents can access this important information. Now, as we close and as we venture into next week and beyond, I want to echo the gratitude that was expressed earlier to our community for their collective work that has helped us decrease COVID-19 case rates, and for those that have volunteered to receive the COVID-19 vaccine for the sake of our greater community. Those efforts are going to position Marin on very strong footing to keep COVID-19 at bay. And keep in mind that we don't know what each other's pandemic experience has been, and we likely all have very different comfort levels with reopening. And as Dr. Lisa referenced earlier, not only is this a difficult adjustment for kids getting back to what we once knew as normal, but it can be a really tricky adjustment for adults too. So this is a time for us to come together, to continue to come together as a community, to listen to and support one another as we navigate through the concerns that we all might be experiencing at this moment, whether it's not being real sure about being okay with taking off that mask just yet, or getting the vaccine, or even gathering in larger groups with friends and loved ones. So this is kind of my closing call to action to all of you to keep supporting one another and as a community by listening and acknowledging each other and meeting us where we are, each and every one of us. We're on the road to community immunity, and for those of you that haven't yet had a chance to be vaccinated, there's still time to roll up that sleeve and help each other being safe and COVID-free. Remember, there's also some incentives happening right now. You could get a shot and become a millionaire. You never know. So you can find information on where to get vaccinated at coronavirus.marinhhs.org/vaccine. It's on the screen right now. If that's too much for you to write down, getvaccinated.marin.org will get you there as well. Also, testing was referenced earlier, and if you're interested in that COVID-19 test, it's coronavirus.marinhhs.org/testing. And of course, that coronavirus.marinhhs .org is your home for all things COVID, as well as a way to subscribe to that status update publication. As a reminder, again, if you didn't get your question answered, don't worry, our COVID-19 response team is ready. You can also contact them via that website. And finally, I'd like to extend one last thank you to our outstanding panel this evening, Supervisor Dennis Rodoni, Dr. Matt Willis, Dr. Laura Eberhard, Mayor Brian Colbert from the Hamlet of San Anselmo, as well as Dr. Lisa, who had to leave a bit early. Thank you all for this wonderful session. That's it for today. Thanks for watching, and remember to stay safe, Marin. We'll see you again very soon.